I'll tell you what, if you just live long enough, that starts getting a little long, doesn't it? So it is such an honor to be here with you today. I did not know that Linda was going to be introducing me. I think the world of her, so I was super excited to walk into this room and see some of my favorite people, and I cannot say enough about these two. One, all of their support for our organization, but when I was just getting into politics, watching Johnny work was just an honor. And I truly, truly wish that we had individuals as knowledgeable and as hardworking as you are. And so I just recognize both of you and how honored I am to be talking about this work in front of you all. But okay, we've got a lot of things to talk about, because in 20 minutes I'm going to try my best to tell you about the things that happened at the state capitol during the legislative session early this year, but also to touch on, you know, just a handful of the things that are happening in the federal government right now. And I will also make sure I leave time, because I imagine we got things to discuss. So with that being said, as noted, I'm Keesa Smith-Brantley. I'm the Executive Director of Arkansas Advocates. Linda gave an amazing overview of who we are, but we are a 47-year-old organization that has been working for years on issues surrounding children. And the individuals that got together back when Hillary Clinton was the First Lady of Arkansas said that things are happening at the Capitol, but nobody's talking enough about what's happening to children. And if we're not talking about children, then we're not talking about the future of Arkansas. And so I have the privilege of only being, in our 47 years, our 5th director focused with that mission. So we're going to jump right in. The 93rd General Assembly completed their business portion on April 16th. It seems like that was so long ago, considering all the things that have happened since. And excuse where it says adjourned yesterday. My folks have not cleaned up this slide. So during that session, 1,026 bills were signed into law by the governor. That is an extremely large amount of bills, but about average. Considering what we've seen here lately. We had sine die, which means that the legislature has officially concluded its business shortly after. That means that the legislature will not come back until this upcoming 2026 fiscal session, unless the governor calls a special session. Fiscal session in 2026 will start in April of next year. So we should start getting prepared, because as you will see, there's a lot of things that our legislature should be talking about. We did note up here that the legislature will not officially reconvene. Of course, they meet in the interim, but they will not officially reconvene until the fiscal session, unless a special session is called. We've kept these notes because if you listen to the governor talk, she's talked a lot about wanting Arkansas to go down to zero taxes. And so we are always aware and alert to if in fact she does call a special session, because it will have something to do with lowering our tax rate again. If you have heard Arkansas Advocates talk, we are one of the few organizations that are up there talking about our state budget and our revenue. Part of the reason why we talk about that is that we can't make the investments that Arkansas needs if we don't have the revenue. And so in the last 8 years alone, Arkansas has reduced the amount of general revenue that we have by $3.1 billion. We've cut taxes several times in the last couple of years. And so when you hear a lot in Arkansas about how we don't have money for that, and we don't have money for this, remember that overwhelmingly we voted for repeated tax cuts in the last couple of years. The bullets below, I won't get too much into that because we'll be talking about them later, but at the beginning of the legislative session, the governor announced her priorities, which were the Healthy Moms, Healthy Babies Act, which passed, that's Act 124, Arkansas Access, which was the higher ed response to LEARNs, but ended up having so much to do with K through 12 that it was hard to really label it as a higher education bill. The primary thing that many individuals will know from the new Arkansas Access Bill is that we now will have a combined, like a common application for state schools, but it did, there was a significant section in there that now restricts the right for students, and that's whether K through 12 and or higher education, to have an absence approved if they are coming to talk, if they are coming to the Capitol and or if they are protesting for any reason. So as you know, many professors, particularly political science, take the folks to the Capitol, show them how the process works. That is no longer an excuse absence. There's still some questions as to whether or not that's even going to be allowable. So things to wait and see. Also, you have Act 122, which is bell to bell, no cell. I think folks have heard about that, which is the fact that school districts, public school districts and charter schools are now responsible for ensuring that, that cell phones are not in the classroom. And there's been mixed reviews. A lot of individuals are happy about that. You know, I'm a product of the 90s, so of course we remember when we didn't have cell phones. So we didn't have that distraction. I obviously have a daughter who grew up in the cell phone age, and sometimes I'd have to say, aren't you supposed to be paying attention to class? Why are you texting me? It's 10 a.m. But that provision did not give teachers and school districts funding for that. So as you have probably heard on the news, there's been mixed ways in which school districts have been responding to that. Some have been trying to lock them up in little lock safe envelopes. Others are requiring them to be in the locker. And so it's kind of a mixed reaction in terms of how schools are dealing with them and how kids are responding to that. So bless the Lord if any of you all have teenagers that are dealing with phone withdrawal during school. So I wanted to start it with education, and what we tried to do with this presentation is to really give you the highlights. As you heard, there was 1,000+ bills that were signed into law, and so I want to talk about the things that may have made the news or things that you've heard about. So we do have Act 195 from Senator Caldwell and Representative Burks, and this tripled the amount of literacy tutoring grants provided to public schools on behalf of eligible students. The previous amount was $500, and now that increases to $1,500. The reason why I included that is because many of you probably know already that according to LEARNS, this school year is the year in which children will be looked at in 3rd grade regarding their literacy. If they are not able to pass literacy tests in the 3rd grade, that they have the potential to be held back. At this point, there is a large amount of children that school districts are projecting are likely to be held back. Somewhere close to 40% of 3rd graders are not meeting the literacy requirement according to information that has been provided thus far. So that is not across school, across the entire state, but that is an average that we're hearing thus far. And so I will say that school districts are responding, and this is part of the response, is to try to get more money for tutoring into the schools or directly to the students so that we don't have such a large number of children that are held back. And I will tell you from conversations directly with the Department of Education, unfortunately, there is not a lot of solutions that are being provided to school districts about what to do if in fact that occurs, meaning what is going to happen to class sizes for children that are currently in 2nd grade as they try to go to 3rd grade, but a number of children are being held back. So that is something for us all to pay attention to and watch and talk to, you know, our educators and see how we can support. The second one is what we just talked about, the bell to bell no cell. That is now Act 122. It was sponsored by Senator Dees and Representative John S. Eubanks. And then we have Act 340 and 341, which is together makes the Arkansas Access Act. So we talked a little bit about what the restriction for students to be able to engage in political protest. It also makes some changes that pertaining to our advanced placement trainings. That has been changed. It's now called accelerated learning. Again, trying to figure out what the rules are around some of these new things that are different than what we're used to. It also states, like we said, no political protests. it has required the Department of Higher Education to update the higher education funding formula. That is extremely, extremely concerning for many of us that are watching higher education, and we should all be determining what that looks like. Because if it is based on graduation rates, then that will be good for our largest institutions like the University of Arkansas. It will not be great for our smaller public institutions because they often take children that need remediation and things of that sort. And so if that is counted against the institution, then that's going to be a problem for many children that can't access higher education, but through those facilities. So, and it also, doubled the amount of the Arkansas Challenge Scholarship for freshmen to 2,000. And I don't know why I thought that was higher to begin with. So, but that's a positive thing. So, jumping to healthcare, we have Act 124 and Act 140, which was sponsored by Senator Missy Urban and Representative Pilkington, and that's the Healthy Moms, Healthy Babies Act. You probably heard a good amount of discussion about that. Arkansas has one of the worst maternal mortality rates. We are number 4 in the country related to the number of moms that pass away in our state on average while trying to give birth or either through postpartum complications. We also have the 3rd highest rate of infant mortality. So you hear a lot of discussion about being pro-life. However, we're not doing enough for moms in this state, particularly rural moms, as we see hospitals close, meaning that women have to travel further for access to health care. So Healthy Moms, Healthy Babies was a large bill. One of the biggest things that it did was that it said it gave moms that are, it allowed moms to be eligible for what we call presumptive eligibility for Medicaid. And what that means is if I am a pregnant woman and I go into a facility, a clinic that takes Medicaid, then they have to presume that I am eligible for Medicaid, meaning they have to serve me right then and then deal with the eligibility later on. Because if any of you all have gone through the Medicaid process or know individuals that have gone through the Medicaid process, then you know that it can take 60, 90 days for applications to be processed. And if you're pregnant and say you're finding out a little bit later, then you could be almost ready to give birth before you're able to have your Medicaid covered. So this will allow for moms to get seen immediately, which is a good thing. But the other parts of the bill primarily unbundled Medicaid payments. And to not get into a super complicated description of that, if you are a doctor that takes Medicaid in Arkansas, you were not getting paid until the mother gave birth. So she could come for multiple visits and they would not get paid. And when they did get paid, they got paid $2,500 to give prenatal care and to help deliver that baby. And so this unbundled payment so that a doctor would, or a practitioner, whomever is providing care, would get paid at every visit, and they've increased the amount of reimbursement. Now, are they going to increase the amount of reimbursement? That has not been finalized yet. It also does things like covering blood pressure monitors and remote ultrasounds. There was a lot of bills filed during this session that covers parts of how to receive care. And when I say covers, meaning like now those services are Medicaid eligible. We also had Act 965 and Act 435 from Senator Urban and Representative Lee Johnson. Those were 2 separate acts, but these were a big deal because it provided a certification process for community-based doulas and for community health workers, respectfully, in Arkansas. There is a growing movement. It's a great movement to see where doulas and community health workers will now, their services will be covered by Medicaid, expanding the amount of people, the number of people that women can get care from. The first process in getting Medicaid eligible is to have a certification process, so this is the first step. So very happy to see that. And equally, Act 556, which was also by Senator Urban and Representative Johnson, requires health insurers to cover services provided in mobile units in the same way that it is covered in healthcare settings.
for the purpose of trying to address our more rural settings that don't have access to health care. All right, taxes and economic incentives. We should be paying attention to this because this is coming down the pipe. First is Act 1008, and that eliminates the remainder of the grocery tax. And Johnny, you remember all those fun conversations that were being had around grocery tax and at that time, or for years. When I was working for Governor Beebe, there was a lot of discussion about getting rid of the grocery tax. So this bill eliminated the rest of the state grocery tax, but if you can't see it in the back, hopefully everyone can see how much was remaining. That is less than a penny. So you would have heard lots of discussion where folks were kind of championing and saying, we got rid of the grocery tax. We got, relief is coming, the grocery tax is gone. Again, less than a penny and does not touch sales tax. Does not touch whether or not your local area decides to raise sales tax as a result of the decrease in the grocery tax. So that is something that we should be aware of. The governor's office is estimating that it will return $10.9 million back to Arkansans. So we'll see. But that goes into effect January 1. We also have SGR 15, which is one of 3 amendments that Arkansans will ultimately get to vote on. This is a constitutional amendment that would allow cities and counties to give incentives to private developers by setting up taxpayer-backed economic development districts. So that this would create a new type of entity that can issue bonds, make grants, build infrastructure, and give tax breaks. So you will likely start hearing more and more about this because, again, that's coming up for a vote. Your city and county get to decide whether or not this is something that you all want to do. But this is something that Senator Dismay and Representative Beatty introduced with the goal of providing more means for businesses to come in. Again, we shall see. I think one of the biggest things that was discussed in this topic area was Act 373 from Senator Dismay and Representative Eads, and it was called Generating Arkansas Jobs Act of 2025. The purpose of this legislation is to create a more competitive energy infrastructure in Arkansas to attract new industry and create jobs. The key to this is that the bill allows utilities to cover costs incrementally during construction, offering a long-term lower rate for consumers compared to the current model. That's how it was described. It also emphasizes strategic investment decisions and public service commission oversight. But to be clear, what this allows in Arkansas, we are going to have 2 coal plants that are going offline in the next few years. What this allows is that whenever a utility wants to create a new plant energy source, they can go ahead and prorate the cost of that facility and build that into your electric or gas bill. There was a lot of discussion about this, a lot of pushback from legislators concerned that individuals were going to complain, their constituents would complain to them because those prices are already going up. And so what does this mean when Energy or Summit or any new utility company decides that they want to pass these costs on? But as you see, it is Act 373, so it is now law. The utility company does have to provide what their plan is to the Public Service Commission for approval, but the likelihood of that being turned down is low unless folks are out there and aware of what's happening. And so that's why we talk about these things, so that you will know and be able to follow what is happening at the Public Service Commission. So, hunger, SNAP, and child care, try to consolidate those 3. The first one was such an exciting bill to see passed. It's Act 123 from Senator Dismay and Representative Bramlett, where it sets, this is the free breakfast bill. I will be honest in saying it started off as the free lunch bill. Then there was high hope that it was going to be breakfast and lunch, and then it turned into breakfast. But we take our victories where we get them, which is this is a major thing for hungry children in the state of Arkansas, and very excited that it passed. The funding for Act 123 is through medical marijuana funds. So just
That's interesting.
very, very, very interesting, and and maybe an argument for how we should be able to use those funds and maybe expansion of those programs so that we could have more of those funds. But that's Keesa's personal opinion. So we then have Act 969, and that was filed by Senator Penzo and Representative Mary Bentley. And that this will require DHS to request a waiver that will allow Arkansas to exclude from SNAP the payment for candy and soft drinks. This bill did pass. It passed at the same time that the governor also submitted a waiver to the federal government asking for the same thing. There was a press conference about it. I will tell you that the devil is in the details as someone who led DHS for a long time. It will be interesting to see how we define candy and how we define soft drinks. We've talked to grocers who have said, is candy anything with chocolate in it? So you can't, individuals can't get protein bars, you can't do granola, things of that nature. Obviously, chocolate is cereal and things of that nature. How do you define soft drinks? Is it sparkling water as well? So there will be a lot of discussions. This isn't as easy as the talking points may sound. And grocers from Walmart to Edwards and all in between are not too pleased about it. So we'll see what happens with this. Act 587 from Senator English and Representative Brandon Aker allows for childhood workers to participate in the Arkansas teacher retirement system. The caveat to this is that early childhood workers will not be entitled to state matching funds. So this was a way to try to help childcare workers try to grow the number of childcare workers that we have in the state and to try to support them. I'll talk at the end about what could have passed, but this was the alternative. It is very significant to note that there's not going to be a match for these workers. So that doesn't provide the incentive to participate in the program. And for many of us that understand how this works, it just means you have access to the folks who are working the system on behalf of the teachers, but they don't really get the benefits unless they have the money to put into it. Two quick things pertaining to housing. We did not see movement on housing as we thought that we would. And Act 459 highlights kind of the tone during the session, which is that Senator Penzo and Representative David Gray passed a law that would prohibit any local government from enacting an ordinance or resolution capping rent, rental application fees, or rental deposits. This is in direct response to certain cities coming up with their own solutions pertaining to rent and trying to help individuals within their community. Now, a builder or an owner can do this on their own if they choose to. It cannot be a local government action, which again is unfortunate, as we all know that cost for housing is rising. Act 313 from Senator Hester and Representative Clowney allow for accessory dwelling units. These are also called granny flats or mother-in-law suites. That allows them in every city, and this prohibits cities from being able to ban these forms of dwellings. When I made this presentation, I get mixed reviews. Some people are really happy that this is allowable because in certain cities they're restricted and they have the space and they want to build these. In other places, they've talked about how this can be abused, how people can rent those dwellings out, thus leading to more and more, cars parked on the street and things of that nature. And so we'll have to see if more regulation comes from that. Really quick, we have Act 449. It's from Senator Tucker and Representative Beatty. Bipartisan act. If you are not familiar, we just went through the census. Arkansas severely undercounted. And you want to know what? We did not dedicate the resources to counting. We specifically tried to not count individuals that were here legal immigrants. We made no effort in more rural areas to count individuals. The undercounting that we did was so severe that the federal government at the time estimated that we lost out on millions in the pool. That it may cost the state somewhere close to 10 to 15 million in federal dollars, if not more, because of how much we undercounted. Senator Tucker and Representative Beatty got together in conjunction with our organization and the state chamber, and we are now going to have a committee to prepare us for the 2030 census. And Lord, I got the numbers real wrong. Our undercount will cost the state more than $5 billion. Excuse me, I said it. Said an M when I should have said a B. So by estimates, it will cost our state $5 billion. Other states that equally undercounted were Florida, Illinois, Mississippi, Tennessee, and Texas. So we are not in a good group of individuals who actively try to undercount their citizens, and it will impact us. Quick pertaining to state, because I do want to hit federal real quick, and I'm sure I'm out of time, but I want to get to what's happening in the federal government. I want to note that we had a big missed opportunity, which was House Bill 1004. There were a lot of opportunities to do something good, but this was filed and on its way through. If you do not know, Arkansas is the only state in the country that does not provide Medicaid postpartum coverage for a year. We are the only state. We only provide postpartum coverage for 60 days. Through the Affordable Care Act, so all the way back to when the Affordable Care Act was put in place, states were given the option to extend postpartum Medicaid coverage to 12 months. We did not take it then, and we have not taken it since. This legislative session and the session before this, Representative Pilkington filed a bill. Representative Pilkington is a young Republican rep out of Russellville. But he has said that his party cannot say that they are pro-life if they don't care about the care of mothers. And he is the loudest advocate for maternal health. It's very interesting that a young man is the one that's championing that, but he has been dogged about the fact that we need this. It made it out of the House. It got over 70 votes to make it out of the House. It got stalled in the Senate committee, and then it was killed. And after it was killed, we had a conversation with the governor's office, and the governor's office staff members told us that they feel like it's duplicative, meaning they feel like these women can get on Medicaid expansion. We pointed out the fact that healthcare subsidies are about to go up this year, which we will talk about before I wrap up. But unfortunately, that did not move the administration. I will say that Representative Pilkington is dogged about this and has said he won't stop trying. Again, we have a very dubious label of not having passed this bill. Despite the fact that, again, as we talked about earlier, we do not have good maternal mortality rates or infant mortality rates. If this is something that's going to help moms, because over 48% of our maternal deaths happen during the postpartum period. So a lot of people think it happens during birth or complications prior to, but there are a number of things that can happen after women give birth, and we're not addressing that when we can. So another missed opportunity is House Bill 1761 that was filed by Representative Denise Garner, and it would have established tiered income caps for the education freedom accounts or the vouchers, however you know them. It would not have taken, if this would have passed, it would not have taken it away from anyone who already had it. Now, this was before vouchers became universal in this school year. So at that time, it would have brought in everyone who already received a voucher, and then it would have tiered it so that we are truly addressing families that cannot afford private school, as opposed to what we've seen so far, which is that the majority of the vouchers are going to families who can already afford private schools. In this discussion, legislators openly talked about the fact that they know that they have to put some type of financial constraints on this program. Otherwise, it's going to continue to grow and grow, but they were not yet ready to do this type of structure. And so we count that as a missed opportunity, because it was an opportunity, because as we see, we've already gone past what we said we were going to cap that program at. House Bill 1435. This is, when I mentioned child care workers being in the teacher retirement system, I said that there was a missed opportunity, and this is it. So House Bill 1435, which had the same sponsors as the teacher retirement bill, would have addressed tax credits to businesses that financially support the child care need of their employees, as well as created an income tax credit for licensed child care providers. So if a business elected to provide any type of child care benefits in their benefit package, they would have received a tax credit for doing that, with the hopes that more businesses would be able to try to build that into their benefits package. Unfortunately, that bill stalled. It had the teacher retirement portion in that bill as well. They pulled that piece out, and that was the only piece that passed. These pieces would have cost the state funding. It would have been capped as well, but the decision of the legislature and the administration was that that was too big of a cost, and so they elected to pull it out and only do the teacher retirement portion. House Bill 1018 by Representative Hudson would have been a tax credit pertaining, in a similar vein, employers who paid family leave and medical leave to qualified employees. If the So a way to incentivize paid family leave that was not taken up as well. And then House Bill 1915, I've listed Senator Dismay and Representative Eubanks. It would have increased the state asset limit from $3,000 to $6,000 and allowed households receiving food assistance to save more of their income or own more assets. That is our state asset limit regarding our SNAP program. We are one of the few states that have an asset limit pertaining to food assistance. So what that means is you can be completely eligible, meaning you meet the income limits to receive food stamps. Whether it's because you're disabled, whether it's because you're not working, or whether because you're working and you're not getting this, the salary that pays a livable wage. What assets limits is separate. When you go to DHS, you have to declare what your assets are. So if you have assets that exceed $3,000, you will not get food stamps, no matter how little money is coming into your household monthly. What this means, and we saw this because I worked at DHS for a long amount of time. This is why you see and hear people talk about, for both Medicaid and food stamps, having to get rid of, houses that may have been deeded to them years ago. They may not even live in the homes, but they own land and it's in excess of these funds. These are all things these are often things that individuals cannot cash out and get funding, money for, but yet we have an asset limit. Senator Dismay and Representative Eubanks tried this during the last legislative session. It was killed. They tried it again. Their understanding was that the administration and the Department of Human Services were ready to go on it, but DHS actually testified against it in the House. And so it died, and we will have to see if Senator Dismay and Representative Eubanks will try again during the next legislative session. So, forgive me, whew, all right. So obviously that was not everything that happened during the legislative session, but we definitely tried to hit the highlights so that we don't run out of time and I don't run over the time that I have. I want to make sure that I get to equally what's happening in the federal government without even touching on our government shutdown that we have right now. So HR 1, the big beautiful bill, the big bad bill, the big Republican bill, however you call the bill, HR1 was a mega bill and it did a number of things.